Myself Dr. Sonali Kagne. I am an endocrinologist presently working at Sir H. N. Reliance Foundation Hospital. Today we are going to discuss thyroid diseases in pregnancy. So, how common are the thyroid disorders during pregnancy? Hypothyroidism or underactive thyroid is seen in 2 to 3% of the pregnant women, whereas hyperthyroidism, that is overactive thyroid, is seen in 0.1 to 0.4% of pregnant women. What is exactly hypothyroidism? When your thyroid gland produces too little of the thyroid hormone, it is known as hypothyroidism or underactive thyroid. Whereas when your thyroid gland produces too much of the thyroid hormones, it is known as hyperthyroidism or overactive thyroid. As we all know, thyroid hormones are very important for each and every cell of our body because they are involved in energy production from the food that we consume. Hence, if thyroid functions are deranged, it can affect the pregnancy as well. When it comes to the pregnancy, it is the health of the baby and the mother, both, which is important. And the thyroid derangement or thyroid dysfunction can affect the health of the baby as well as health of the mother during pregnancy. How do we know that a woman has a thyroid dysfunction? So, the thyroid disorder can be diagnosed just with the help of a simple blood test which measures the level of T3, T4 and TSH in the blood. Once we know that this thyroid function is deranged, we can treat it with the help of certain medications. When a woman has hypothyroidism, then we treat it by replacing the thyroid hormone with the synthetic T4, that is nothing but a levothyroxine. This can be taken in the form of a pill which the woman can take once daily in the morning. Because we are replacing the same thyroid hormone which your body produces, it doesn't have any side effects. So we can safely take levothyroxine during pregnancy. When it comes to treatment of hyperthyroidism, the treatment depends on the severity of hyperthyroidism and the risk and benefits of the anti-thyroid medications that we use for treatment of it. The medications that we generally use, those are beta blockers and anti-thyroid medications known as propyltyrosine or carbimazole or methimazole. These medications can cross the placenta and enters the baby's blood in a very little amount. However, it can also lead to some kind of birth defects. So, whether it is safe to use these medications or not depends on the risk and the benefits involved in treatment of the hyperthyroidism with these medicines and keeping the thyroid functions within normal range versus the risk of not treating this condition. And this decision is to be taken on an individual basis and it differs from patient to patient. When the hyperthyroidism is very severe and it may involve in the use of very high doses of these anti-thyroid medicines, sometimes we may advise to postpone the pregnancy till the time we take some definitive measures for treatment of this hyperthyroidism. And these definitive measures can be treatment of the overactive thyroid by using a radioactive iodine, which kind of kills the overactive thyroid cells and maintains the thyroid function in normal range. When we treat a woman with radioactive iodine, we advise them to avoid pregnancy for the next 6 months. The another option for treatment of hyperthyroidism is a surgery which involves removal of the entire thyroid gland. And once the thyroid gland is removed we can replace the thyroid hormones with the help of a tablet which is levothyroxine. If we consider what are the side effects of not treating the thyroid dysfunction, we need to understand why it is very important to maintain the thyroid function within normal range during pregnancy. So the thyroid gland of the fetus forms by 12 weeks of gestation, and it starts functioning by 18 to 20 weeks of gestation. So in other words, the baby is completely dependent on mother's thyroid hormone for first 12 weeks, and it's partially dependent on mother's thyroid hormone for the entire gestation, and hence it is important that we keep the thyroid functions within normal range during the pregnancy. The thyroid hormones are very important for the development of baby's brain, its mental health, and its normal development post-birth. If the thyroid dysfunction continues during pregnancy, it can also increase the risk of miscarriages, the low birth weight babies, premature birth, stillbirths. It can increase the risk of preeclampsia, which is gestational hypertension. How does the pregnancy affect the pre-existing thyroid conditions? So as we know that the fetus is dependent on mother's thyroid hormones during the first 12 weeks of pregnancy and partially throughout the gestation, the thyroid hormone requirements generally increase during pregnancy. So some women who are already on thyroid hormone replacement, they may need to escalate the dose of the thyroid hormones during the pregnancy, and the dose may need to be adjusted throughout the pregnancy. Hence, we generally advise to monitor the thyroid function test approximately 4 to 6 weekly throughout the pregnancy, whereas in a non-pregnant women we generally monitor it every 3 to 4 months. So what happens to the thyroid function post-delivery or postpartum period? When a woman delivers, the requirement for the thyroid hormone replacement in a hypothyroid woman also reduces, and accordingly we need to reduce and adjust the doses of the thyroid medicine in the woman. We generally recheck the thyroid function after approximately a month after delivery and thereby adjust the doses of the levothyroxine. When it comes to hyperthyroidism, the requirement for the antithyroid medicines increases in the first trimester. It can reduce or stabilize during the second and third trimester. However, after the delivery, the hyperthyroidism can again increase, and accordingly we need to escalate the dose of the medicines. In summary, the thyroid function is very important for pregnancy, for the health of the baby as well as the mother. The diagnosis and treatment of the thyroid dysfunction is very easy and it is available. Hence, if you have any queries, any issues related to the thyroid problems, you can reach out to us at any point in time. Thank you.